Hi, I hope you're doing well and having a great day or evening. My name is Samantha and I'm an occupational therapy student. At my current fieldwork placement, I am working with individuals with lymphedema and or breast cancer who are seeking support in order to manage their lymphedema or seek preventative care and learn more about lymphedema. And I am not an expert in this. I am a student. I'm not lymphedema certified. I just want to make this video in order to offer support for your lymphedema or preventative care and just give some tips for lymphatic flow. So even if you don't have lymphedema or you're not concerned about anything at all, this can also just help promote your lymphatic flow if you have a healthy lymphatic system. Or maybe you're watching the video to support a loved one who has lymphedema and or breast cancer. So these are some tips that you could give to promote their lymphatic flow. Before watching this, please do consult with your doctor or lymphedema therapist for you to get the supports that you're needing. Because this video just is reviewing lymphatic flow, but there's treatment that you'll be needing if you have lymphedema or if you have breast cancer or you're curious about lymphedema, and a doctor or lymphedema therapist can offer you preventative care. And if you don't have a lymphedema therapist, then please ask your doctor for a referral because they can, again, offer you supports in your lymphedema, or if you don't have any swelling or you're not really concerned about it and you have breast cancer, they can support you in terms of lymphedema prevention as well as reducing tightness, pain, and increasing your range of motion. If, for instance, you're noticing like tightness underneath your arm or of your chest wall, they can offer you support in that. So now I'm just going to get into these lymphatic flow tips. So the first one, and I'm also going to have a PDF of this handout in the video description, and you can find that underneath of the title of the video. There will be a description, and you can click, if you don't see it, you can click on 3 dots to expand and then see the description. So the first one is deep belly breathing, and this is great at any time, this deep diaphragmatic breathing, whenever you get a chance, just if you're sitting, whatever you're doing, like if you're at work or you're at school or you're at home relaxing or reading a book, you can engage in this deep breathing. And it's also just relaxing, and it can reduce stress, and it does promote lymphatic flow in your body. So you can breathe in through your nose for about 2 counts, and then out through your mouth for about 4 counts. So breathe in, smelling the flowers, and breathe out, blowing out the candles. And you can also close your eyes when you're breathing, if you're comfortable with that wherever you're at, or if you're relaxing at home. That can just help to concentrate in on the breathing, or you can kind of just relax your eyes but focus on one object in front of you, just to focus more in. And then another tip during breathing is that you can place a hand on your stomach or both hands over your stomach, and then that way you can feel the movement of your stomach. So when you breathe in, you want your stomach to move outward because it's filling up with that air, and then when you're breathing out, you want to aim for your stomach to move in because then you're pushing that air out. And if you feel lightheaded or dizzy, stop doing that, the deep breathing, and return to your normal breathing. Everyone is different and everyone responds to things differently. So you can also just lessen the amount of time. Like maybe you're just spending a little bit too much time on the breath in and out. So that's a way that you can navigate that. And the next tip is hydration. So your lymphatic system is working really hard to remove toxins from your body. And it is always working really hard without any type of treatment or intervention or anything. But again, like I mentioned before, like if you do have lymphedema or you're at risk, then your body does need some type of intervention or treatment in order to address that. So make sure again to contact your doctor or your lymphedema therapist. So hydration is really beneficial for your lymphatic system, and it is important to make sure that you're staying hydrated because again, like with your body removing all of that fluid, you need to get water into your body, and it might seem the opposite of what you think, but you don't want to get dehydrated from removing this fluid. And the last but not least, the next tip is movement, and this is any type of movement. You just want to get moving because your lymphatic system is actually passive. So your heart is beating automatically, and that's part of your circulatory system, and your lymphatic system is part of the immune system, but it supplements the circulatory system. They're working together, and your blood vessels and lymphatic capillaries are along the same pathways. Like if you think of it, you can think of it like they're intertwined, they're moving together. So while your heart is automatic, your lymphatic system is not, it's passive. So you need to move your body in order for the fluid to be moving around. And you don't limit yourself, just move whatever you need to do. Like even if you feel unsteady when you're standing up and then that is kind of limiting you, you can do movement when you're seated. So you could do different chair exercises or like chair yoga or stretching in a chair. So that's a tip on that. Like don't let yourself be limited. And then exercise can also help reduce fatigue. So that helps energize your body. If you're feeling like more stagnant or tired and not able to move around, within reason, movement is great for that. It counteracts that. Obviously, like don't overwork yourself. Like you do also need to rest, but it is important for your body to be moving. And specifically, aerobic exercises tend to be beneficial for the lymphatic system. So that's something like walking, running, riding a bike, or swimming. And a bonus to swimming is that it is a natural compression. So if you do have lymphedema or you're at risk, as long as you have your affected limb or limbs underneath of the water, they have to be fully submerged, then it is preventing you from swelling. And then other options are to try yoga, and yoga also integrates deep breathing, so that's great. You get both of those tips in on there. And you could try Pilates or again chair stretches. And it is also important to wear compression garments during all different exercises and movement for lymphedema management and prevention. So, and if you have a healthy lymphatic system and you're watching this, that is not necessary. But if you are at high risk or you do have lymphedema, put on that compression garment in order to prevent yourself from swelling. So, and you can also, there is a video out there if you wear a compression sleeve and handpiece. There is a video on there for garment application and a little bit more about compression garments. So you can check that out on this Lymphedema Education and Support YouTube channel. All right, thank you so much for listening. I really appreciate it. I'm happy that you came on here, and you can go on to the YouTube channel that I was just talking about to see the different videos and resources that are out there for you. Thank you. Have a great day or night. Goodbye.